Now to some really good news for people who use Medicare. The Biden-Harris administration announced that it has reached a historic agreement that will bring down out-of-pocket prescription costs and save $100 billion for taxpayers. In a joint rally on Thursday, Vice President Harris had this to say.
Medicare represents more than 65 million people. And so Medicare has collective bargaining power. And now Medicare can use that power to go toe-to-toe with Big Pharma and negotiate lower drug prices.
And joining us now to break things down is public health expert and physician, Dr. Yalda Safai. Welcome, Doc. Good to see you.
Good to see you. Thank you so much.
Good. So on average, how much do Medicare recipients spend on prescription drugs overall?
See, the problem is every year it changes. As inflation goes up, the price of old medications and new medications rise. And a lot of times the pharmaceutical industry is not transparent of what is driving the cost of manufacture to go up. So every year it kind of gets worse.
Well, I wanted to ask you, is it really inflation that drives the prices up, or is it the pharmaceutical companies?
That's the thing. They're not transparent what is driving the cost, the manufacturing cost, but they're saying the price of everything goes up with inflation, so this is one of them. You have to understand the U.S., we don't have a central system that regulates drug costs. It is completely up to the pharmaceutical industries, like you said, who are for-profit, private entities, and I emphasize the word for-profit, to determine the cost of prescription drugs. That's the problem we have in this country, and a lot of developed countries don't have this problem.
All right, so let's talk about some of these negotiated lower prices for medicines that treat illnesses like cancer, diabetes, heart failure. On average, how much savings are we looking at here? Because I just saw the breakdown from what drugs cost to what they're going to cost now under this new plan, and it's monumental, the difference.
It is significant for the recipients of Medicare. However, when things like this happen, somebody has to pay. So one of the controversies surrounding around this is maybe they'll just drive up the premiums for Medicare. So the money has to come from somewhere. Somebody has to eat the cost. So we're saying it's great. You save thousands and thousands of dollars in prescription drug costs, but something somewhere has to give.
As far as the negotiations here for lowering these costs, are all Medicare enrollees eligible?
So the thing is, some of the pharmaceutical industries can opt out of doing business with Medicare and Medicaid. However, they're going to lose a lot of money if they do that. So because there's millions of people who are recipients of Medicare in this country and Medicaid. So it really becomes a balancing act between, is it more beneficial for us to opt in and abide by these rules and cap costs, or should we completely opt out? So we're going to see what they're going to do.
Okay, so what you're talking about there is if they opt out, obviously they lose billions. They're currently making hundreds of billions. If they have to adjust their costs, they lose a few billion. So
exactly.
If you're running Novo Nordisk or one of these big pharma companies, what would be your play? What would you say?
Exactly. So I mean, I don't know. It's a balancing act. Because the thing is, if they opt in and they violate the legislation, they're going to be taxed up to 95%. So if they're going to opt in, if they decide to opt in, they need to abide by these rules verbatim. So it really becomes a balancing act. I don't know. If I were a CEO of a for-profit organization, it all comes down to money, right? But we're just going to see what they're going to do.
But you talked about premiums obviously being the downside, that the money's got to come from somewhere. But when you look at a breakdown of the costs for things like Eliquis and Jardiance, these drugs that are used by tens of millions of people nationwide, to see numbers come down annually from 10,000 now to only 2,500, your premium's going to go up a little bit, but it's still nothing considering what you're saving now with these drug costs if you need to use these drugs.
Exactly. Most people over the age of 65 use some of these medications in one way or another. And it's on a list of only a few medications, which includes medications for diabetes and heart disease. A lot of people over the age of 65 are using these medications on a monthly basis. So I might be in their favor to do so. But the driving up of the premium cost is one of the things that people are discussing. And that's why it's so controversial. They're saying that the money has to come from somewhere. Where? It could be the premiums, but you're absolutely right.
So let me just ask you this before I do let you go. Between insulin costs now being capped at $35 and something like this, now mind you, this isn't going to happen until 2026, but looking down the road, do you think these are these big bonuses for people on Medicare and that older generation?
Oh, definitely. Most people over the age of 65 use one of these medications in one form or another. And these are medications for chronic illnesses that you have to take every month, every day. So in the long run, they will benefit, yes.
All right, public health expert Dr. Yalda Safai, thank you very much. We appreciate you joining us. Good to talk with you. And again, these new prices don't roll out until 2026, as I mentioned, and some drug makers have sued the federal government to try to stop the negotiation process because, of course, they don't want to be taking more money out of their pockets. For more information, head to our website, cbsnewyork.com.